Hi and welcome to today's live chapter reading of Come Back Tomorrow by Amy Argent, courtesy of Itsy Bitsy Book Bits. Chapter 1. The door has barely closed on my last patient when I hear a quiet tapping. I've already switched on to chart annotating mode, so I don't even look up as I call, "Come in." The door swings open and I glance up to find Jenny, one of my best friends and a nurse on the oncology floor, leaning against the doorway. I grin up at her, but then continue with the notation I'm making. I don't want to forget the exact words my last patient said regarding finally coming to terms with his wife's death. "What's up, Jenny?" "Hey, Tori, I have some work for you." "On your floor?" "Yes." Sighing, I pause in my notation. I love my job at the hospital. I've been a practicing psychologist here for 6 years, and I get a great deal of satisfaction from working with my patients, particularly when I'm able to help families through the grieving process after losing a loved one. But I have another job, mostly in my off hours. About 2 years ago, I overheard a few of the nurses talking about a terminal patient on the oncology floor who had no family coming to see him, and I knew I had to meet him. Over the next few weeks, we formed a friendship, and I was able to help him find some happiness in the last days of his life. After that, I made it a point to ask the nurses to tell me when they had a patient like that who got no visitors, and the rest, as they say, is history. I am now the go-to psychologist when a terminal patient with no family is discovered, and I've made it my mission to offer them friendship and comfort at a time when they are most in need. It's work I feel compelled to do, but I'm not taking any new patients at the moment. "Jenny, I know you're taking a break for a while, but this one I just couldn't let go." Over the last year, I befriended and supported 4 elderly patients as they made ready to leave this world. The last died about 3 months ago, at about the time I broke up with Peter, my boyfriend of 4 years. I really thought he was the one, but we had irreconcilable differences. In the weeks that followed, I was very depressed. Hell, sometimes I think I still am. My therapist told me to take a break for a while, to take some time for myself to heal from both the breakup and the amount of time I've spent face to face with death. I rub my temple, trying to ease the ache that's formed there. "What have you got for me?" "William Everson, 29, angioimmunoblastic T-cell lymphoma, stage 4B. My gaze snaps up to her. 29. Jenny just nods, her hands clasped together in front of her. Jenny's been working on the oncology floor for 5 years now, and I swear she's seen everything. This one has her rattled. My curiosity's piqued. He was brought in for a secondary infection a week ago. He was delirious at the time due to fever, but he begged us not to treat him. He has a DNR in place, but that only applies to intubation, not antibiotic treatment. Even after he was back in his right mind, he still asks us not to treat him, but that would violate the hospital's ethics code. No one's come to visit him the entire time he's been here. He wants to die, and quickly. He's completely given up." She finishes, and then there's tears in her eyes. "Should he have given up?" I ask softly. "You need to see him." After finishing my notes on the day's patients, I head up to the oncology floor. Jenny's still working, so I check in with her at the nurse's station. "He's in room 412. He was having some pain today, so he's had morphine, but I think you should still be able to talk to him." Nodding, I head down the hall, stopping outside the door and steeling myself. Jenny's reaction to this guy has me on edge. Not wanting to invade his privacy, I knock softly but hear no response. I don't want to knock hard enough to wake him if he's sleeping, so I open the door just a bit and peek in. If he's asleep, I'll come back another day. Angling my head around the door, I draw in a sharp breath. Even as sick as he is, William Everson is stunning. His hair is a mass of brown, wavy locks, strewn with brassy red highlights, made even brighter by the fluorescent hospital lighting. It's relatively short on the sides, but long on the top and hangs down onto his forehead. He has bushy eyebrows that match his hair and a chiselled jaw that's squarely strong in the front. His shoulders are broad, and although his hollow cheeks tell me he's underweight, clearly he has a muscular build. Oh wow. Completely lost in my ogling, I push the door open a little further, and it squeaks loudly. He whips his head up, and the greenest eyes I've ever met meet mine. I start breathing again with a gasp and shake my head. I smile at him tentatively, and what happens next blows me away. His gorgeous face breaks into an absolutely incredible smile. His eyes seem to turn an even deeper green, and small laugh lines appear at the corner as his cheeks pucker into a boyish grin. His full pink lips narrow to reveal perfectly straight white teeth, and the spread of his cheeks fills in the hollows, so that if not for the circles under his eyes, I don't think I'd even be able to tell that he's sick. His smile stays there as he looks me over. He's waiting for me to say something. I shake my head again and take a few more steps into the room. "Hello, Mr. Everson." "Hi there," he responds lazily, his head rolling a little to one side. Looking closer, I notice the glassiness of his eyes. Exactly how much morphine has he had today? "My name's Tori. Would you like some company?" If by company you mean you, I wouldn't mind at all. His eyes rake me over in a way that makes certain parts tingle. I clear my throat and sit in the chair at his bedside. "How are you feeling today, Mr. Everson?" He grins at me again, his tongue poking out between his lips to moisten them. "Please, call me Will." Then his brow furrows adorably. "What did you ask me?" I can't help but chuckle as I realise what kind of conversation this is going to be. He's seriously high from the morphine. "I asked how you were feeling today." "Right, sorry. Well, I think I was having a crappy day. But then the nurses gave me this." He holds up the button of the infusion pump for the morphine. "And then you came by. So at the moment, I'm feeling pretty good," he says with a grin. Can't help but grin back at him, and I also can't bring myself to ask him any serious questions. He's in too good a mood, and I don't think I would get any straight answers anyway. "I'm glad to hear that. You're—" "Never mind," he murmurs, blushing to the roots of his hair and looking away. "What were you going to say?" "I was going to say, you're pretty, but it didn't seem like a good idea for some reason," he answers, looking perplexed. "That's okay, you can tell me I'm pretty." He closes his eyes and opens them again slowly. "Hey, I think you're getting a little tired. Why don't you rest up now and I'll come back and see you tomorrow?" I suggest, moving as if to stand up. He grasps my hand, surprising me. His fingers are warm and soft, and my skin tingles under his fingertips. I look into those impossibly green eyes, now tinged with sadness. "Will you stay, at least for a few minutes? You're the first visitor I've had," he says softly, "and I remember why I'm here." "Oh, damn. Of course. Close your eyes and rest, and I'll stay right here." "Thank you," he whispered, as his eyes pulled closed, finally succumbing to the pull of the morphine. I sit there for a while, just watching him sleep. He's gorgeous. Jesus Christ, Tori, he's dying. You're not supposed to notice how good-looking he is. But I can't help it. He's one of the most handsome men I've ever seen, despite the obvious signs of his illness. And I have so many questions. Questions that don't even come to mind for elderly patients. How did he end up in this place, seemingly at the end of his life, at such a young age? Where are his family and friends? Is he keeping them away somehow? Or is there truly no one who cares about him? I find the latter very hard to believe. Hell, I've known him for all of 5 minutes, and I can already see my journey is taken with him. I can feel his pull on me too, even though we just met. He seems pretty easygoing. Maybe it won't be too hard to get to know him and find out where the people are who care about him. But God, he's so young. This is so different from anything I've ever done before. I've never befriended a terminal patient who wasn't elderly. Can I really do this? I already suspect that this will be the hardest terminal friendship I've ever made. But as I watch him sleep, I already know I can't turn my back on him now. I already told him I'd come back tomorrow.